to start our presentation. And so I'm really excited for this call with CareMessage. You know, we've talked so much about outreach, engagement, finding new ways to reach our patients and community members. And I think this is a unique way that we can really start pushing those things forward. And we've worked with CareMessage and as they've worked with all of you quite a bit in the past. So I'm really excited to have Mayor Wiley here to talk a bit about CareMessage in general, talk about the different options and structures they have for moving things forward, and then getting into some examples of how that could actually work for us before we have a Q&A. So if you have questions, keep thinking of those. You can put them into the chat and we can save those for the time when it's appropriate. But I'm really excited for this call, and we've got it recorded, so we'll be able to share out with anyone else that hasn't been able to join from your organization or others. So with that, Mayor Wiley, do you want to take it away?
I will. Thank you so much, Ben, for allowing us this opportunity to give this webinar for the state of Wisconsin today and your FQHCs. You kind of already went over a little bit of the agenda. I'm going to spend some time on just background of CareMessage. I see some of the people that have signed up for the webinar kind of know who we are, but for those that don't, a little about who we are and what we do. And then really the goal of my time with you today is to share more about CM Lite, which is our free version of our platform. But I'll also, as an FYI, take you through all the full platform features as well. We continue to create use cases, and we'll continue to share use cases with the PCA and also with you if you're a CM Lite user. We've just seen a lot of creative things come out of COVID and vaccine education. Then I'm going to take you to the site just for a quick demo, and then hopefully we can save at least 15 minutes at the end for Q&A. Okay, so just a little bit of background about who we are. CareMessage is a nonprofit healthcare technology organization. Our mission is really just to empower healthcare organizations just to improve the patient experience, self-literacy, and self-management. So our focus has really been on helping safety net organizations that are serving underserved populations just leverage mobile technology in a very specific way with SMS messaging to communicate with their patients. Our vision is really just a world where all people, regardless of income or background, can achieve equitable health outcomes. And so that's really been our focus for the last, I'd say, 9 years since we launched in 2012. We've really been hyper-focused over the last 18 months on COVID response and vaccine communication. I think one of the core aspects of CareMessage is just the work that we've done with FQHCs and really measuring that success using texting as a mechanism for communication. We are the nation's largest patient engagement platform. What makes us unique is that we focus exclusively on underserved populations, or FQHCs. What organizations are able to utilize through CareMessage, since we are a HIPAA compliant platform, but we're really here to support you to streamline communication, to help you automate your workflows, to help collect data like for HEDIS and UDS measures, which is so important, all with a focus towards improving outcomes and impact and overall patient engagement. We are really, really proud. We have hit over the 10 million mark for text messages that we've sent out around vaccine education and vaccine hesitancy. I wanted to kind of just share some of the FQHCs that we've been working with in the state of Wisconsin. I know that I've personally worked with Partnership, Progressive, Kenosha, and Gerald Ignace, but these are just some of the folks. And really, a lot of these FQHCs, they started off with CM Lite and then moved on to the full platform. Something I wanted to highlight real quickly, I don't have the YouTube video, is that Gerald Ignace continues to show up on our dashboards as being one of the top FQHCs for sending out a lot of messages around the vaccine coming in, for the booster shot. And I just thought it was so interesting that Dr. Ignace actually put a YouTube video out there. They pushed it out through Facebook, and I believe they pushed it out through CareMessage as well, just showing him getting the vaccine. I think they even brought in some music. Was it Wade Fernandez, just to comfort patients as they came into the center. So we thought that that was just really, really cool. So I wanted to share a little bit of what we're offering today. So really, as a mission-driven nonprofit organization, when COVID happened to us last year, we developed a light version of our platform that you can see here on the right. So unlike our fully integrated platform, which takes about 10 to 12 weeks to implement because we offer that bi-directional appointment reminder, CM Light is free, and it's free for at least 60 days. It can be provisioned in a couple of days. There is a BAA that you sign for $0, but it's standalone. So you really don't have to get IT involved in this. And you can also upload patients and staff just through a manual way through File Center, which takes about 5 minutes. And then you'll have access to 2 features. So you'll have group outreach. And with group outreach, you can reach large groups of specific patients with messages about COVID or vaccines or recalls, things with gaps in care. You can do events, medication adherence, just general education. So when we're looking at CM Light, even though we've created that free version around, vaccines and COVID, we're really wanting to expand the use of that as you do start looking at quality measures and other things that you need to promote. Also, we have that direct text messenger. So that's just a way that instead of using your own personal cell phone, you can have a direct one-to-one conversation with your patients. So think of your care coordinators, your patient navigators, your case managers. We've done a lot of studies on this that we're seeing that by using direct messenger, it's cutting down the time in half to communicate with your patients. We do have over 150 FQHCs and around 50 free and charitable clinics that have taken advantage of CM Light. So we're just very grateful that with CM Light alone, the impact that we've had through messaging and vaccine education and closing gaps in care. So on the left, and this is really just as an FYI, just to kind of give you the highlights of our fully integrated patient engagement platform. So really driving down no-show rates, which is so important. Even though that changed a little bit for us when we made the shift to telehealth, we found that the no-show rates were getting better. But now as people are starting to come back into the centers, that bidirectional or HL7 appointment reminders can really help with that. Also outreach, which I just mentioned, which is one-to-many, that's your large communication, your quality measures. Just want to let you know that not only have we written templates for you in culturally relevant English and Spanish and CM Light for your COVID outreach, we have on the full feature side, we have over 300 and something templates that are written for you, or we empower you to write your own. The one-to-one messenger, again, just a quick way to send a personalized bidirectional message between your patients and your staff. We've really seen direct messenger come in handy. We found that one of the studies was when people weren't coming in for their second vaccine, we launched some things through direct messenger, and we found that one of the reasons people weren't coming in for the second vaccine is they had a challenge with either childcare or transportation. So there's many, many use cases around direct messenger. We also offer educational programs. Now, these are geared around the chronic conditions of the underserved. So when you're looking at things like diabetes, hypertension, nutrition. So it's more like health coaching for behavioral change. And we're really excited that we've added to these education programs some things around social determinants of health, which I can talk a little bit more about in the demo. And we've just released 4 gaps in care programs that are around breast, colon, cervical, and fit kit. That are automated messages, which have been fantastic to push out to patients. We also offer patient satisfaction surveys. If you're doing these manually today, we do have a 6-question patient satisfaction survey, but you can also embed a link into outreach if you're using a tool like SurveyMonkey. And then finally, our newest feature, if anyone's ever worked in referrals, you just know how much of a challenge it is just to close that loop on referrals. So this is a 4 automated message, like a set it and forget it, that follows the patient from once the referral has been approved all the way up until they have gone on that appointment. And so I mentioned as part of CM Light, we've created over 80 message templates with the support of our vaccine advisory board. We really started shifting our focus lately to the second vaccine, to the booster, to the Delta variant, and for the states that are kind of slipping into the red. But we continue to update these templates with feedback from our customers. So we'll continue to share with you. And just because data is important, I just wanted to quickly highlight 3 FQHCs that I thought they had some interesting data points. There's an FQHC in Texas that had about 900 vaccines to schedule. It took 6 staff members 4 days to complete. And so for the second batch, they decided to use CareMessage for that 900, and they did it through outreach, and it only took 2 staff members 2 days. So look at that huge time savings. There's another FQHC in Louisiana that sent an outreach to the vaccine for eligible patients over the age of 70. We had nearly 1/3 of them that responded with no, because most had had the vaccine, with 2/3 responding yes to receiving the vaccine. So we thought that that was great. And then the last one, just an FQHC in Arizona, used a self-scheduling template. We're seeing that more and more, especially for the vaccine, just to kind of push something out so people can pick an appointment time. And they used it to schedule 700 appointments, and they saved over 116 hours. You really can't see like this little link down here to read the full story, but there is a link to the full article that we did with the University of Pennsylvania, because we know, fit kits are just something that's not easily returned. And we saw by using CareMessage that they had a 17.3% higher return rate. And y'all can click on that full article. We'll send you this after. And just the last slide before the demo, since we all have to be very metric and data driven, there are just a few more health outcomes, lowering A1Cs and increasing cancer screenings, improved medication adherence, and then through our educational programs, this one's on diabetes that just improved the overall patient experience or patient satisfaction. So that's a little bit of the kind of the background and some of the things that we've done. I'll continue to kind of share with the PCA, updates on what other FQHCs across the US are doing. We have about 400 FQHC partners, and we're in about 43 states. So let's go out to the site. I think I'm gonna have to share it again. Hold on just a second. Share. All right. So hopefully y'all can see my demo page. Somebody speak up if you cannot. I've gotten halfway through this before and somebody said, we're not seeing your screen. So hopefully you can. Can you see it?
Not at the moment. I think you may need to reshare your screen.
Okay, well, thank you for telling me. Let me try that. Hold on. Share. Okay. Now I'm gonna go up. Now, perfect. I know you can because I see you're at the top. Cool. All right. Good. I love it when technology works. So here's where you log into CareMessage. Even with CM Lite, we'll send you a username and password, but we are software as a service. And all that means to you is that we're located securely in the cloud. There's no on-prem equipment. And being a software as a service, this does allow us to really be more innovative and to be more agile, that as we continue to update our features based on our customer feedback, we can make those changes very quickly. So this is our landing page. My goal is really just to kind of not get into too much features and functions, but things that are really relevant to you. But it really is a super easy, user-friendly system. One thing you're going to pick up on as we go through the demonstration is that since we have to be very data and metric driven, each feature has its own dashboard. So that's where you can get all of your reporting you need to meet those quality measures, just to see that you're moving the needle. This one is just simply showing me on my landing page the patients that I haven't messaged in the last 12 months and the one that I haven't messaged in the last 3. Down here on the bottom, I usually don't really go into this as much, but we do have a patient engagement calendar that we can work from. You can work from ours, you can work from yours. These are just simple messages that have something to do with either nutritional tips. This one is going back to school, physical appointments are available for like your new child visits. They're just reminders of things that go out the first Thursday of every month automatically. On the left-hand side, this is just your navigation bar. These are where all the features live. So let's kind of go through what the experience would be with CM Lite first, and then I'll go into the other features. So with CM Lite, unlike the full platform, you're not really assigned a customer success manager that really will be your strategic partner, because we found that it's so easy to use, but we have allowed you to use things like our chat bot. So you can talk online with one of our customer success managers. I can go in and I can say, upload a file. It'll give me step-by-step instructions, if I spelled it right, on how to upload a file. I can even go out here and I can schedule a video call with one of our customer success managers, just to have them walk you through it. All kinds of documents that have all of our templates in it are located in the Help Center. That's a great way to start. It's just kind of to educate yourself. I'll be here if you decide you want to move forward with CM Lite. I'll do as many 30-minute training sessions for your staff as you need. But then there's always support at caremessage.org. So I think just kind of knowing where the tools are that are going to support you as a user. The next is I want to show you settings. So you can set up as many staff members as you need. And I get asked all the time, okay, well, what kind of people are the users of CareMessage? I would say anybody that's responsible for outreach communications, usually your quality people. You can have maybe some front desk people if they're going to be confirming same-day appointments, but it's not a full-time job for anyone. And the time that it takes to use CareMessage is just really based on the number of campaigns or direct text messages that you're going to be using. So all I need is first name, last name, and email. I can set people up with as a staff member, or I can set people up with staff supervisor, meaning that they can have access to PHI. I think it's nice here on the settings because you can always tell who your active users are, who's been disabled on that as well. So that's a good place to start. No limit to how many people can go into CareMessage as a user. So now that I've got my staff people set up, I need to figure out, okay, I want to launch my first campaign. So the way I do that is I need to get my patient data into CareMessage. The way we would do that is through File Center. File Center is just a vehicle in which you upload a CSV file. Sometimes people get IT support to figure out how to download a CSV file from your EMR, but it's really not hard. And then you'll have two options for which to upload the file, and this is important. You can import patients in groups. I really like patients in groups because groups allow me to do targeted campaigns. Like I can upload my hypertensive group, my diabetic group. I can upload, child immunization group. You can also import members. We encourage you to import your staff into CareMessage and communicate with them. I can't tell you with logistics and vaccines how much this has helped other FQHCs by just being able to tell a member that, no, we've changed the vaccine site from this one to this one. So there are other things that you can do, but I would say let's focus on import patients with groups or import members. Once you've done that, it's just really simple that you'll have to go through a few phases. So the matching phase, all you have to do in the matching phase is you figure out what you really need and you just match that column header to all the information below. I think the most important one here is the group information, to make sure that you always put a group in there for targeted campaigns. After you've done that, then you can go through a verify stage, and the verify stage, it simply is going to pull up information for you that will show you if you had an error, and then you can just click into that error and I can change it on the fly. So super easy. I promise you, this might be the most challenging thing you do. A lot of people upload their staff members first and communicate with them. But once you get them down, literally, this does not take that much time. So now that I've got my patients into CareMessage, with CM Lite, I'll have access to two features. So let's go into outreach first. Outreach is the most heavily utilized feature on the CareMessage platform. One, because it's so easy to use. And I love that we've now come up with smart tags. I love when these things pop up. But instead of, before you had to do like percentage, patient, first name, underscore, now you can just use the @ sign for to be able to personalize your messages. So just as I said, outreach heavily utilized. We have over 200 use cases of how outreach has been used. So this is my dashboard. Remember I said there's a dashboard with every feature. So I can go in, let's say I'm looking at my colorectal screening for 2021. So it tells me exactly how many patients it went out to. It tells me my retention rate. It tells me what the message said. I can go in, I can kind of look at my patients. So we kind of see that Moira or Johnny Rose, they've not really given me a response. A fairly new feature for us is instead of like relaunching the campaign, if it's a small campaign, all you have to do is hover over Stevie Bud's name, and I can send him a direct text message to say, we were asking you about the colorectal cancer screening. Is it yes or no? But it'll show that trail with them. So know that you can go in to each campaign, see the summary of each campaign, get your reporting from the patient. So I may want to download a report of everyone that said no response, even though that's what exactly this one is. I can look at things for response flags. So I can see if I get an error message, if it comes up under needs review. So I can make sure that I've got a clean campaign. So do it real time here and hover over the name, or you can download the report and manipulate the data. So let me show you just how super easy it is just to create an outreach campaign. So I go into create outreach. So the first thing I need to do is, what patients do I want to send this message out to? I can go over here and I can do things on status, which are enabled and disabled. Disabled means that we've had a patient that is opted out, that I may want to reach out to them again to see if I can bring them into the fold. And I can do things by language, English and Spanish. We do support English and Spanish, and we'll do the translations for you. If you're interested in other languages, we're really excited about this. We are now working with a firm on translations. I know that Hmong was something in Minnesota that we're going to be adding, but please let us know if you're interested in doing things in other languages and you don't have that expertise in-house, because we'll be introducing that by Q4. So I can filter on the left-hand side, but my preference is to do the easy button over here. So I can just kind of look at, let's say, this is my breast cancer screening group. I can just go in and I apply it. I select everyone that's in there and I save it and I'm ready to go. So now all I have to do, remember, we've got plenty of templates out there that you can use ours or you can create your own. What we've seen most FQHCs do is they use ours and they might edit them a little bit. So I can just go in here and I can kind of find, I think I picked one that I don't have in here. So let's just say that this is going to be my flu shot reminder. So the flu shot reminder comes up. This is a no response needed. You can see that you can personalize these with patient first name or the provider name. So let's talk about no response needed. Think about this as clinic closures. I know that when Gerald Ignace sent out the YouTube video, they just embedded it in a no response so people could click on that. You can do bit.ly links to YouTube, to any of your social media accounts like Facebook or Instagram. I know a lot of you have put a lot of good COVID-19 messages that's on your website. You can direct them to your website, but no response needed can be something purely informational or educational, but remember those links. You can also do things with multiple choice. I think of multiple choice as something like with fit kits for some reason that are never returned, like we mailed you one, did you receive it? Can you please return it, or do we need to send you another one? But there's plenty of things. I was looking for my one in telehealth, but I don't think sometimes these things just go missing. I've seen them used for telehealth when they're asking, like, do you prefer a telehealth appointment? Do you prefer an in-person appointment? I've also seen them used about vaccine hesitancy, like an ABC, just trying to figure out why people haven't gotten the vaccine, if they feel like it was rushed, if it feels like it's going to harm them. So then let's say all the people that answered A or all the people that answered B, we can pull those cohorts out in a group and start educating them, start sending things to them kind of based on their response. You can even do an ABCD for a quick patient satisfaction survey at the end of the week. We also have yes or no. I think yes or no is something that would be, did you get your flu shot? And if they answer yes, they'll get one response from CareMessage. If they answer no, they'll get another one. Then the last one is just an open-ended response. Open-ended just simply means you could ask the patient anything that you want to, and they have a free-form text field in which they can respond back. So in looking at all, now after we've gone in and we put all the information in, we're satisfied with it, you've got up to 320 characters, which is a lot, in each box. Then all you have to do is go through and schedule it, the month, day, and year, hour, minute, XMs for AM or PM, and the frequency in which you want it to go out. I would say most of these are probably going to be once. The things that might go out on a weekly basis would be if y'all are doing some type of nutrition class. I've seen some things go out daily of we have vaccines available. It's first come, first serve, but something that's in a constant loop to send to people to get them in. So that's everything on outreach. Think of outreach as a way to just better communicate with mass groups of patients. Also think of it as a way of kind of getting people in for their screenings so you can really start looking at those quality measures. Next is Messenger. So I showed you how you could use Messenger when we were toggling over the patient's name and outreach. But Messenger is just a way for you to have one-on-one direct communication with your patients. The blue dots just indicate that we need to respond to David and Ferris. But the way this works is I can just go in and type the first initial of the person's name. I can go in. If I haven't talked to them before, please identify yourself, even though the number will come from a Wisconsin area code. Just like this is Mary Wiley, I'm your care manager with CareMessage. We can communicate this way Monday through Friday. I have seen some of the top use cases in this for confirming same-day appointments, even with CM Light, to give it to your front desk staff, just to ask them if they need help with transportation. This is good for COVID negative or positive. If this is something that's sensitive PHI, we are a HIPAA compliant platform, but more than likely you're going to be texting to burner phones and flip phones. So it's probably good either to say contact the office or to put a link into your patient portal. This is just, we've seen such a spike in usage for this that we've started creating templates. You can use ours or create your own, just so your folks that are using this just don't have to type in the same message over and over again. So this is like clinic check-in protocols. I've got a lot of things with like just general resources. So it's really nice that you can kind of personalize these and push them out to your patients. We even have some fail-safes built in here that if a patient tries to send you a text message at 1 o'clock in the morning, we can say this is outside of our clinical hours. Please contact us at this time, or here's a hotline number. So that's everything in Messenger. One thing that I wanted to show you that is not included in CM Lite, but it's fairly new for the folks who are interested in the fully integrated platform, and I'll go into the appointments next. This appointment rescheduled via Messenger. So the appointment reminder goes out to the patient. If they say yes, it'll book it on the schedule in your EMR. If they say no, it'll remove it from the schedule in your EMR, but it'll also send them this message, which you can edit, to say, we realize that you can't, we saw that you can't attend your appointment on this month, day, and time. We'd like to reschedule your appointment. What dates work best with you? So we're just constantly trying to help you to get those patients in the door, even if they need to reschedule. So that's everything in CM Lite. Just real quickly with appointment reminders, I don't think it does it justice because you'll still go into your EMR to send out the appointment reminder. It'll just flow through CareMessage. We'll work with you to create as many appointment templates as you need. This is an example of a new patient appointment template. I can do them RSVP or just no response required. So if they respond and they say, yes, I can make the appointment, then I can put in like, bring your ID, or this is a telehealth appointment. And then after that, you can send up to 3 different reminders on that. So I think one of the most important things here is while you can still get reporting out of your EMR, we have robust reporting that you can also get out of CareMessage, that I can look at scheduled, active, canceled, and completed. I can look at patient responses, so I can really be interested in the ones that are not going maybe or no response and start direct text messaging them. And I can do it by provider, and I can queue those up to come out on a daily basis to that individual. Then just 2 more features, education programs. Like I said, these are great health coaching programs that really, empower the patient just to practice better self-care on their own. We're really seeing a spike in these as well because people just aren't coming into the office as much. So this is just a great way just to push them about 3 to 5 text messages per week. The nutrition program, a good example there is there might be a question that the patients ask, like, is there a reason why you can't eat more nutritious foods? Is it A, cost, B, access to good feed resources, or is it C, I don't know how to cook? So if they said A, it's cost, then it's a customizable link. We could push something out to them and say, you could be eligible for food stamps. Here's how you apply. If they say, I don't have access to good food resources, we'll do the research on the food banks that are in that area and we'll push those out. If they say, I don't know how to cook, we've got plenty of recipes that cost less than $5 that can feed a family of 4 that are very nutritious. So these are not only words of encouragement, but we're asking them questions so we can then kind of follow up with something to really help them. Also, as part of the programs, real quick, we've just added a social determinants of health, a survey, and a 4-week program. This is just a way of going out and polling your patients to find out, do you need help with finance? Do you need help with housing? Do you need help with food? Once we figure out what category they're in, then we can put them in a 4-week program that, let's say if it's something around food, that we can send them links to Feeding America. There's all kinds of great links that we can send with them just to make sure, that they are getting what they need. This is also where our patient satisfaction survey lives. As I said, use ours or use yours. Ours is very, very simple with 6 questions. On a scale of 0 to 10, how likely would you recommend us? I received the care that I needed. My healthcare provider listened carefully to my questions and concerns. My culture and values were respected, and it was easy to schedule an appointment, with the final one being, what can we do to improve, which is open-ended. And then last but not least, our referrals, and something that we're working on right now is that you would still import these referrals today through File Center. We're working on, got an SFTP or bringing those in. And then also, once that loop is closed on the referral, having it right back to your EMR. But basically, this is just 4 automated messages that once they're an open referral, they'll get something that says it's been approved, open your blue envelope, schedule your appointment. And then automatically they'll get the next one and say, have you scheduled it, yes or no? And then based on that response, we'll say, when is it scheduled? When's the month, day, and year? And then with 24 hours after that appointment, they're going to ask them, did you indeed attend that referral appointment? So that's everything. Just to quickly review, CM Lite, use the Help Center, set up your staff, upload manually through File Center, automatically create your groups, and you'll have access to Outreach and Messenger. And then here's everything that we are fully integrated platforms with 99.9% of the EMRs out there. And we also do partner with Eye2Eye, Relevant, and Azara for population health tools as well. So I'd like to end the demonstration there so we can open it up for questions.
Thank you so much. This is really exciting to see all the potential options. So if you do have questions, feel free to unmute and ask directly, and we can just have this as a conversation. If you'd prefer to type it into the chat, I can relay those messages as well.
Hi, this is actually Parker with WPHCA. I actually do have one question. I'm curious, given that this tool touches a lot of different staff at a health centers, from outreach staff to some of the more clinical staff, as you've worked with health centers across the nation, how have you seen sort of how they've managed that and ensured that there's good communication between staff who might be focused, more purely on outreach and versus other staff who might be focused more on quality improvement and care gaps? And I guess, how have you sort of seen this tool? Is there generally like someone who owns it at a health center, specific role, or how is that sort of dynamic usually work best?
Yeah, and I can share some best practices.
Hang on.
We've got, the others might want to mute. I can share some best practices, but typically, one lead for the project. In the very beginning, I know that Gregory at Kenosha was the lead, even though he just kind of helped bring all the right people together. During implementation, it's usually someone that is responsible for outreach, and then we spread it out into clinical. So we don't try to boil the ocean in the very beginning. I mean, even with CM Light, we figure out, okay, let's start with your vaccine and your COVID strategy and who's responsible for that. So we look more at your workflows and how we can improve, drive down some of that manual burden. And then from there, then we can kind of select the people. It's like, what are your top 3 patient engagement priorities? If that kind of fell into something with outreach, or if that's going to be in more education, then that's how we turn on the programs. But, having one person as the lead to bring in others and kind of we've seen it be successful when people have at least, a weekly or a monthly meeting just to kind of go through the reports. And we're always interested in your success. We love to collect that data because we share that out into the FQHC community of like, look at this great idea. I know in Alabama, it was really interesting for the vaccines, they just weren't getting people to come in. And so they offered free hot dogs with a free, vaccine, and they lined up for 2 blocks. So you never know what's going to work. So it might depend on the state, but
maybe cheese curds for us.
Cheese curds, I know, maybe cheese curds for everyone. But I'll share it with Ben after the call, just some of the best practices of kind of, who to bring in. But it's really geared off of really what your patient engagement priorities are. If it's quality, then where are we going to start in quality and who needs to be involved with that? If it's clinical, closing gaps in care, we really need to work on all of our screenings, which I tell you, these programs that we've just added in for those gaps in care have been fantastic. We're even considering for some people that are signing up for CM Light that may be turning those programs on as well if they felt like it's something that's going to help move the needle.
I think that's really interesting, especially for our members that are in value-based contracts where those gaps are incentivized.
Mm-hmm.
Eileen had a question about which EHRs you're integrated with. Is ECW one of those?
ECW is our newest one, and
all right.
and we love ECW, but ECW wasn't so crazy in the very beginning about they would let us pull information from, but not let us write back to. But we are working on one of our first integrations for that, and we're really excited about it. So yes, with ECW, sometimes people, we're working on integrations with some people, but what a lot of folks have done is they've just kept their appointment reminders just with ECW, if you're happy with those appointment reminders, and then just do everything else with CareMessage. That kind of drives down the cost because ECW is going to charge you a fee for that integration. But we've seen a lot of cost savings in that if we just do our appointment reminders and we do outreach and everything else with CareMessage, because we don't charge by the voice or by the text, we charge a flat rate per patient per year for unlimited texting and voice.
I'm excited about that model. I feel like that opens up so much more opportunity for really extended engagement with the patients.
We're excited about it too.
Are there other questions that are coming up for folks? One of the things that really stood out to me when you were sharing some of the success stories of, just the time that it freed up. And, I think you show kind of one half the equation that it took so much less using CareMessage, but that also means they opened up the schedules to do even more. And, I think with how overwhelmed I think everyone's time is, I think that's almost a greater benefit in terms of just what else you're able to do with it.
And Ben, we've seen, like, I think, especially in rural areas that we've done a lot with, is just the time savings by not only just using text, but just improving workflows through, some type of automated communication. That it's just, that's probably been like the number one, I would say, on our list is time.
Just making those smoother and easier. I'm not seeing other comments come in through the chat. Is there anyone on the phone that would want to unmute and have a question or anything else that stands out?
Ben's going to send you this PowerPoint, but if y'all are interested in something of CM Lite or even the full platform, here is my email address. We're even offering you the free resources. If you're even using someone else, please let us help you. You can go into our message library and use our telehealth videos as well.
I think that's really generous of you, and I think that's it is a great resource. I just highly recommend you reach out to that. So we will share that. We'll share the recording. If you have questions or comments later, I always think of things when my 4-year-old wakes me up at 3:30 in the morning. Don't hesitate. I won't offer to send them to Mary Wiley, but you can send them and we'll be able to connect them that way. And we look forward to our partnership with CareMessage moving forward and where things can go next. Mary Wiley, thank you so much for your time today. I really appreciate it.
Thank you so much, everyone. And Ben, thank you for